I'm Dr. Joshua Delito, a family physician, and this week I'll be discussing about hematuria. Hematuria is the presence of blood in the urine, and usually it is obvious when we talk of hematuria when there are more than 3 red blood cells in the urine. The hematuria could be microscopic, which is not visible to the naked eye, or it can be macroscopic, which is visible and gross. And usually the urine is what the patients will tell you that the urine looks like Coca-Cola when you look at it. So usually the common sources of blood in the urine could be from the kidney themselves, it could be from the ureters, the bladder, or from the urethra, and in ladies it could be a possibility that the blood is coming from the reproductive system. So this could be a very worrying condition, and it's good to know what are the common causes of blood in urine. The first cause is usually a urinary tract infection. The infection could be in the lower urinary tract infection, where you have either the bladder and the lower part, or it could be an upper urinary tract infection affecting the kidneys. An infection will present with the increased frequency of urination. There could be fever, and also there could be chills. Then it could an enlarged prostate can also cause blood in urine. Kidney stones, sometimes vigorous exercises, especially running for a long distance on an empty bladder. Menses, as I said, in females, you can have prostate infection. Sometimes some medications and any form of trauma to the urinary system. So these are the common, what we would call benign causes of blood in urine. Then of course we have now the serious causes, which include the urinary tract cancers, which could be bladder of the cancer. You can have kidney cancers. And the evaluation of the presence of blood in urine includes the history. You want to know how did they start. Is the urine blood throughout? Is it at the starting of the passing of urine, or does it occur at the head? What are the accompanying symptoms that the patient have? Is there difficult passing urine, especially for patients whom you suspect to have prostate problem? And in ladies, it's always good to ask about the menses, because sometimes you may think that there is blood in the urine, which you could be worried, but usually the blood is as a result of the menses, depending on how the sample for examination was taken. So the tests that we do to evaluate the cause of the hematuria include a simple urinalysis. This will tell you the color of the urine. Of course, you can do microscopy, find out apart from blood, what else is in the urine. You are looking for proteins. You are also looking for white cell count, which would guide you whether there is a urinary tract infection. Then you can also do the urea and the creatinine to find out whether there is any serious compromise to the kidneys. An ultrasound, you can do a pelvic ultrasound. This will help you look at the bladder, if there is any masses or any change in the contour of the bladder wall, which could be a sign of cancers. And also you can also check the size of the prostate. You can also use the ultrasound to estimate, is the patient able to pass the whole amount of urine. Then you can also use the ultrasound to check at the kidney size. You can also use the ultrasound to check at the ureters. Are they of normal size? Are they enlarged? Then there's what we call the KUB, which is usually a plain abdominal X-ray. that you take, and usually this is to check for kidney stones. Usually most of the kidney stones, especially which are occur in the ureter, are opaque, and you can be able to pick them in the X-ray. Then you have the CT scan. You can do a plain CT scan of the abdomen, and also you can also do CT KUB, and this will help you to check for stones. So the management is basically dependent on what is the cause of the blood in the urine. And so if it's an infection, then the treatment is treating the infection. If it's a kidney injury, then it will depend on the kind of injury. For stones, then there are some stones that may need a surgical removal. Some of them you just allow them time. And also for malignancies of the urinary tract system, then there are different treatment protocols. So the most important thing is that patients realize that commonly presence of blood in the urine is an indication of an underlying pathology, which some of them could be just benign, and some of them could be life-threatening, and it's always good to seek medical attention when you see blood in the urine. So thank you very much for listening to me, and I encourage you to subscribe to our wellness health talk series, so that you can also benefit from this series and also learn more about taking care of your health. Thank you very much for listening to me.